Today we're going to be talking about bones, specifically some of the bones, features, and structures you're going to need to know for your upcoming lab exam. But before we get started, just really quick, if I say anything that contradicts with your objectives, or if I say something that is or isn't on your objectives, please clarify with your professor or come into the lab for further assistance. And with that, let's get on to the video. Before we get started today, there's a couple different vocabulary terms that we're going to need to go over. Bones, features, and structures. To start us off, we have bones. And when you think of a bone, you probably think of something like this, just one singular piece. And that's what a bone is, a single skeletal element. Whereas features, on the other hand, are parts on the bone. So in this case, we have lots of different parts of this bone that distinguish it from another. These features help us identify direction, how some bones articulate with others, and where they connect to ligaments and muscles and tendons and joints. A structure is made up of multiple bones. For example, we have things like the skull and pelvic girdle. A structure is a skeletal unit made up of two or more bones. Let's look at our first bone. This bone is going to be the rib. And a very important part of your exam is not only going to be identifying what bone you're looking at, but also being able to identify bilateral symmetry. And what I mean by bilateral symmetry is it a left or is it a right? Not all bones have bilateral symmetry because there's just one. So let's go ahead and take a look at this. This is going to be our rib, and there are three features we need to know on the rib. That's going to be the head right here, the neck right here, and the tubercle right here. Now, it's very important to specify when you're talking about things like head and neck and tubercle, you want to specify what bone you're talking about, because there's lots of bones that have heads and necks. So when we write it down, we want to say head of the rib. Not only that, you want to indicate on every bone that has bilateral symmetry which one it is. So let's go ahead and figure that out on this rib. Back here is where all of our features are. Now these features are going to articulate or connect to the vertebra. We know that the vertebra in the body is going to be medial along the center line and posterior toward the back. That lets us know that this is the correct position for the rib. However, does it go like this or like this? The position of medial and posterior doesn't change, but this could be seen as a right rib and this could be seen as a left rib. So let's go ahead and take a look at how we can identify the two. If we look right here, we can see that this has a rather sharp edge, and this side has a rather dull edge. We can tell from this that the sharp edge is always going to face inferior, and the dull, wider edge is always going to be superior. And so with that, we know that it can't go like this because the sharp edge always has to be inferior. So this makes this a left rib. The next bone we're going to talk about is going to be the sternum. Now this is one of those bones that does not have bilateral symmetry because there's only one and it's along the midline of the body. So let's go ahead and talk about the features we need to know. There's a couple dividing lines here on the sternum, and that's going to help us know where, if it's pointing here, here, or here, what feature we're talking about. So starting at the top, we have the manubrium. Moving down, we have the body, and last but certainly not least, we have the xiphoid process. All right, let's go ahead and look at this bone right here, which is going to be our clavicle. First, we're going to look at this thicker end right here. This is going to be the sternal end. Over here, it's much more flat. This is going to be our acromial end. And then right here, this is going to be our conoid tubercle. Now for left and right. First, we need to know medial and lateral. And this is where knowing the names of the features might come really in handy when trying to identify that. Because if you'll know, we just went over the sternum, and the sternum is going to be medial along the midline of the body. So this side is going to be medial. And this right here is called the acromial end. We haven't gotten to it yet, but a part of the scapula called the acromion is where this connects. So with that, we know medial and lateral. But how do we know it goes like this or like this? Position doesn't change. So let's go to the conoid tubercle right here. We know that this is always going to be posterior and inferior. That means it has to be in this position always. And knowing that, this is going to be a right clavicle. Moving on, we're going to have this bone right here. This is going to be our scapula. And let's go ahead and start identifying features. This up here is going to be our acromion. And I mentioned it earlier with the clavicle with the acromial end. Moving on down, we're going to have our scapular spine. Up from that, we're going to have our supraspinous fossa. And below that, we're going to have our infraspinous fossa. This is one of those times where the names of these features can really help because it's already told you which way is upright and which way is down. So we know the bone does not go like this, but rather goes like this in the body. Moving on, this is going to be our glenoid cavity right here. And this is actually where the humerus is going to fit into that joint. Next, we're going to have our coracoid process right here. Moving on, we are going to have our suprascapular notch and our subscapular fossa. With that, let's go ahead and start trying to identify left and right. One tip I will tell you is that you can palpate these bones on yourself to try and identify if they're left or right. So let's go ahead and think about this for the scapula. You can actually feel this ridge on yourself as well as this smooth end. We know that this ridge right here, the scapular spine, is going to be posterior and this is going to be medial even from just palpating it on yourself. Additionally, we know that this is going to be lateral because it's where the humerus fits into that joint. We know the smooth side is actually going to be anterior. And so with that, and the knowledge that this is going to be superior and this is going to be inferior, we know that this is going to be a left scapula. Next, we're going to take a look at this bone right here. This is going to be our humerus. And let's go ahead and start identifying the features. This right here is going to be the head. And this is another time, like I mentioned earlier with the rib, that it's very important to specify of what bone, as to not get confused with other bones and features. So this is the head of the humerus. Moving on here, this is going to be our lesser tubercle. A little bit beyond that, we're going to have our greater tubercle. And in between the two is our intertubercular sulcus. Surrounding the circumference of the bone is going to be our surgical neck. And if we follow the sulcus a little bit down, we're going to find this rougher area of the bone right here. This is going to be our deltoid tuberosity. Moving farther down, we can see a couple different features of the bone right here. Right here, we're going to have our lateral epicondyle. And you'll notice the word lateral was in there. That's going to be used for a directional term later. Right here, we have our capitulum, our trochlea, and our medial epicondyle. Let's go ahead and turn the bone this way. Right here, we can see this big dip right here. This is going to be our olecranon fossa. In the next bone we cover, we're going to talk about what fits in here. All right, so let's go ahead and start identifying left and right. But first, we have to know if this side is the right way up or if this side is the right way up. To know distal and proximal, we're going to need to start thinking about its relation to other bones. This big curved part right here is actually what fits into the glenoid cavity of the scapula that I mentioned earlier. And this right here is going to articulate with the next bone we're going to talk about, the ulna. We also happen to know that this part here is going to be our medial epicondyle, and this is going to be our lateral epicondyle. So let's use this information to put this bone into place. We know this is medial and this is lateral. This olecranon fossa right here is always going to be posterior. So you know that this is the posterior side and this is going to be the anterior side. With that information, we can know that this is going to be a left humerus. Next, we're going to look at this bone right here. Now this is going to be our ulna. And let's go ahead and dive directly into that part of the bone I was talking about earlier with the humerus. This part right here, this feature, is going to be the olecranon. And if you'll remember, the part of the humerus I was talking about was called the olecranon fossa. So that's where this part of the bone fits in. We're also going to have a couple other features that are going to help us understand how the ulna fits into the humerus. We're also going to have this right here, which is going to be the trochlear notch. And if you remember, there's a part of the humerus called the trochlea. We're also going to have this part right here, which is going to be the coronoid process. And additionally, we're going to have this feature right here called the radial notch. And this is actually going to help us distinguish how the radius, the next bone we're going to talk about, fits in with the ulna. Now, the ulna is unique in the way that its head is actually down here. And we're also going to have our styloid process right here. So when we're identifying left and right on the ulna, we have to use the features. And there's a quick trick that a lot of people use. First of all, we have the radial notch. So we know that however the bone lines up, we have to have room for the radius on this side. Additionally, the pinky always lines up with the styloid process. And so you have to lay this bone on your own arm, like a lot of people do to help them study. This has to align with your pinky, but you also have to have room for your radius. So if we were to line it up, we would know that it can't fit here because this is our radial notch, but there's no room for our radius. But if we hold it on this side, we can see that the styloid process does align with our pinky, and there's enough room for our radius on this side. So that means this is going to be a right ulna. Next, let's go ahead and talk about the radius. Starting up top here, this is going to be the head. We're going to have the neck right here, and then this part of the bone is going to be our radial tuberosity. You can see it sticks out a little bit and is a bit more rough than the other parts of the bone. Down here, we're also going to have a styloid process. And again, this is important, styloid process of the radius or styloid process of the ulna. Both are very important to note. Now, very similar to how we decided what was left and right for the ulna is going to apply to the radius. So let's go ahead and take a look at the features on the radius that's going to help us. First of all, I'd like to point out how this side of the radius is very, very smooth, whereas this side is quite bumpy. This smoother side is going to be anterior, and this rougher side is going to be posterior. Also, the styloid process on the radius is always going to be on your thumb side, whereas the one on the ulna was always on your pinky side. So let's go ahead and see if this lines up, with this being anterior and this side of the bone being posterior. If I were to put this on my thumb side, I could tell that there's certainly not enough room for my ulna. But if I were to line it up like this on my other hand, we can see that the styloid process is still going thumb side, but we would have enough room for our ulna right here. So that means that this is going to be a left radius. All right, let's talk about the hand. To start us off, all of these individual fingers are going to be labeled with the Roman numeral from 1 to 5, starting with the thumb being 1, 2, 3, 4, and ending on 5 with the pinky finger. Next, there's going to be 3 different regions of the hand. We have the carpals, we have the metacarpals, and we have the phalanges. Now each one of these individually is called a phalanx. We have our distal phalanx, we have our middle phalanx, and we have our proximal phalanx. Now if you'll notice, the thumb does not have a middle phalanx between its distal and proximal phalanx. Moving on down here, there's a lot of different bones and they can be kind of confusing to look at. This might be a really good time to come up with a mnemonic device to help you remember the names of these bones. Let's go ahead and go through them. First, starting with the bone underneath the thumb, this is going to be the trapezium. Moving on to the bone underneath the pointer finger, this is going to be the trapezoid. Moving on, this bone underneath the middle finger is going to be the capitate. This bone here, underneath these two fingers, is going to be called the hamate. This bone protruding out to the side is going to be called the pisiform. Moving on right here, this bone is going to be called the triquetrum. Moving on right here, this bone is called the lunate, and this bone right here is called the scaphoid. It's also important to know it from this view and this view, as you could be asked which bone it is from either side. Now the hand might be quite easy to tell left and right, but let's go ahead and run over a trick real quick. You can obviously tell thumb and pinky, but let's talk about whether it's this way or this way. It's all in the shape of the hand. When you relax your hand, you'll notice it has a slight curve to it, the same curve that this hand has. And so we know that if we're following that same curve, this is going to be a right hand. All right, let's go ahead and take a look at this structure right here, the os coxa. Now, if you'll notice, I said structure rather than bone because of the fact that this is actually 3 different bones. That might be a little confusing, so let's walk through it. If we flip the structure this way, we can see this feature right here. This is called the acetabulum, and it can be used to help us identify the 3 different bones. We can think of this as a pie chart being divided into 1/3, with 1/3 being here to here, 1/3 being from here to here, and the last 1/3 being from here to here. And each one of those sections is going to be the general region of one bone. From here to here, that is going to be the ischium. From here to here, this is going to be the pubis. And from here to here, that is going to be the ilium. It's also important to note that some features are of a specific bone and some features are of the structure as a whole. So that's very important to note as you go through the features. Let's go ahead and get started. Up top, we're going to have our iliac crest. We're also going to have our iliac fossa. Right here, we're going to have our anterior superior iliac spine. Remember those 2 directional terms for later. We're also going to have our anterior inferior iliac spine as well. Moving further down, right here, we're going to have our pubic symphysis. Moving this way, right here, we're going to have our ischial tuberosity. We're also going to have the acetabulum that I mentioned earlier. We're also going to have the greater sciatic notch, the ischial spine, and then the lesser sciatic notch. We're also going to see this right here, which is going to be our obturator foramen. Now that we've gone through some of the features, let's put together whether this is going to be a right or a left. Well, where the acetabulum is, right here, is actually going to be where the femur is going to slot in and form that joint. So we know that this is going to be lateral. This roughed up area is also where another structure is going to connect that's a part of the vertebra that is going to be more medial. Additionally, the pubic symphysis is where another os coxa is going to join to form that structure right here. So we know this is going to be medial, this is lateral. But we remember these 2 directional terms we mentioned earlier, anterior, superior. So that means this is going to be anterior and this is going to be posterior, making this a left os coxa. Next, we're going to look at the femur. And let's go ahead and jump into the features. This is going to be the head of the femur, and it's what I mentioned earlier that's going to fit into the socket of the os coxa. A little bit below that is going to be the neck. Up here, we're going to have our greater trochanter, and a little below that, we're going to have our lesser trochanter. Also, this little divot right here on the head is called the fovea capitis. Moving down and along this side of the femur, we can see this little ridge right here, and this is going to be called the linea aspera. looking on this side of the femur, we can see a couple different things that's going to be able to help us identify the parts of the femur and whether it's left and right. Starting right here, this is going to be our medial epicondyle. This is going to be our lateral epicondyle, and this is going to be our patellar surface. Now the patella is more commonly known as our kneecap, and so that tells us this is probably going to be the anterior side of this femur. Flipping it around, we can see that this is going to be the medial condyle. This is going to be the lateral condyle, and this is going to be the popliteal surface. And so let's think about left and right. We already know, based on the names, this is going to be medial, and this is going to be lateral. And also knowing that this fits into the os coxa is extra proof of that. Moving down here, we already know this is going to be the patellar surface, and that's going to be at the front, or the anterior side. We also know that this is going to be the proximal end, because it's much higher up in the body. So with that, we can identify that this is going to be a right femur. Next, let's talk about the patella. Now, as I mentioned earlier, this is going to be our kneecap. And the feature we really need to know on here is this right here, called the apex. Now, for identifying left and right, it can be a little difficult, and so let's talk about some other things about the patella that might be able to help us. First of all, this side that protrudes a bit more is going to be the anterior side, and this side with this large divot is going to be the posterior side. With that, we also know that the apex on the patella always points inferiorly, and this more rounded side is going to be superior. So with that, let's go ahead and turn our attention to the back right here. We can see and feel that there's a big divot in the bone right here. And this divot happens to be on the left side. Whatever side the divot is on, it is that bone. What I mean by that is if the divot is on the left side, it's a left patella. If the divot were on the right side, it would be a right patella. And so if you're having a hard time, feel for that divot along the posterior side, and then you'll know if it's a left or a right patella. Next, let's go ahead and take a look at this bone right here. This is going to be our tibia, and a lot of the names of the features of this bone are going to be able to help us identify whether it's a left or a right. So first of all, let's take a look up here. We're going to have our medial condyle and our lateral condyle. We're also going to have our tibial tuberosity, and if we go down here, we're going to have our medial malleolus. That's another way we can tell if this is a medial condyle or not, is we can tell that this is going to be our medial malleolus. And so we already know, based on the names of these, that this is going to be the medial side, this is going to be the lateral side. And this tibial tuberosity is, again, something you can palpate on yourself, and it's going to be on the anterior side of your tibia, meaning that this is medial, lateral, anterior, posterior. This has to be a right tibia. Next, let's take a look at the fibula. Now there's only 3 features we need to know on the fibula, and so let's jump into it. Starting up top, we're going to have the apex. Moving down, we're going to have the head. And then all the way down here, we're going to have our lateral malleolus. Now if you'll remember from the tibia, we had a medial malleolus. And this right here is going to be on the outside, the lateral malleolus. And this is something you can actually palpate yourself near your ankle. You can feel your medial malleolus is on the inside, and your lateral malleolus is on the outside. And so we always have to think about the fibula in context with our tibia. With that, let's go ahead and jump in to try and identify left and right, again keeping in mind that this bone is always going to be on the lateral side of the body. Starting up top, the apex is always going to be posterior. So we know that it's going to have a position like this in the body. But again, we don't know if this is lateral on the right side or lateral on the left side. But we're keeping this apex posterior at all times, but we still don't know what side of the body it goes on. So let's look at our lateral malleolus down here. Now it might be a bit difficult to tell, but there's a slight curve right here. That is going to be the most lateral part, whereas this part is a bit more flat. that's going to be the more medial part. And so, with our apex facing posterior, the curved part facing laterally, and the smoother part facing medially, we know that this has to be a right fibula. Next, let's go and take a look at the foot. Now, a lot of the same rules that apply to the hand apply here as well, but let's go ahead and dive into them. First, it's separated into 3 different regions: our tarsals, our metatarsals, and our phalanges. And we have the same structure here: our distal phalanx, middle phalanx, and proximal phalanx. Again, with the first digit missing its middle phalanx. We're also going to have the same numeric scheme from 1 to 5. 1, 2, 3, 4, 5, written out in Roman numerals. But let's go ahead and get down to the bones here. To start us off, we're going to have this bone here, which is going to be our medial cuneiform, letting us know this is the medial side. We're also going to have our intermediate cuneiform and our lateral cuneiform. Right here, we break the scheme a little bit because this is called our cuboid. And this bone here is called the navicular. We're also going to have this bone here called the talus, and its feature is the trochlear surface of the talus. We're also going to have this bone here, our calcaneus, and then we're going to have the calcaneal tuberosity. And those are the features of the foot. All right, next, let's talk about the vertebra. Well, not all of them at once. To start us off, there are 2 vertebrae that you need to know by name: the atlas, C1, and the axis, C2. What I mean when I say C1 and C2 is that these are cervical vertebrae, cervical vertebra 1 and cervical vertebra 2. But don't worry, these are the only 2 you need to know by name. The rest of them, you just need to know the category they belong to and how many of them there are. This is what a general cervical vertebra looks like. There are 7 of these total. Next, we have our thoracic vertebra. There are 12 of these. Next, we have our lumbar. There are 5 of these. And lastly, there are the 5 sacral and 4 coccygeal vertebrae. Let's start identifying the features with this vertebra right here, atlas, or C1. This is going to be our first cervical vertebra. Before we get started, there's something important to note. While this is just one bone, there is a left and right side of the bone, and so it's important that when you're writing these features, what side you're talking about. Let's go ahead and jump into the features, and then we'll discuss how to identify left and right. First up here, we're going to have our superior articular facets. We're also, to either side, going to have our transverse process and our transverse foramen. On this side, we're going to have our inferior articular facets. And that kind of gave away which side is top and which side is bottom. So we know that it'll go facing this direction, but we don't know if it'll go like this or like this. However, we can kind of tell that it comes to a bit of a point on this side. And as in the case of all these vertebrae, it often comes to a point like this. This is always going to face posteriorly. So we know that this is anterior and this is posterior. With that, we know that this is going to be the right side and this is going to be the left side. An important facet of all of these cervical vertebrae is going to be this feature right here, their transverse foramen. All cervical vertebrae, no matter how different they look, are all going to have transverse foramen. Especially in the case of this vertebra right here, it can look quite different from the rest of these. But they have one uniting feature, the transverse foramen. Next, let's go ahead and jump in to identify the features of this vertebra right here, C2, or the axis. Up top, its probably most notable feature is going to be the odontoid process, also known as the dens. We're also going to see the superior articular facets. We're also going to see this feature right here we mentioned earlier, which is going to be the spinous process. We can also see our familiar transverse foramen and processes. and we're going to have our inferior articular facets. I'm also going to talk about something that all vertebrae share in common, which is going to be this right here. This is the vertebral foramen. It's where the spinal cord goes. We're also going to see here our body. And those are the features of the axis. Next, let's get into the features of one of your average cervical vertebrae. To start us off, we're going to have the body, the vertebral foramen, and the spinous process. Now those features do not have symmetry because there's only one of them and they're along the midline of the body. However, we do have symmetry on the superior articular facets, the lamina, the transverse foramen, and the transverse process. We're also going to have symmetry on the inferior articular facets. So just remember the tip we talked about earlier, with this being posterior, anterior, superior, inferior, meaning that this is going to be the right side and this is going to be the left side. Next, let's go ahead and move on to talking about a thoracic vertebra. Now, a lot of these names are going to sound familiar, but some of the positions might have changed. We have the body, vertebral foramen, spinous process, lamina, transverse process, superior articular facet, superior articular process, inferior articular process. And now let's introduce some new terms. We're going to have our pedicle. We're going to have our superior costal facet, our inferior costal facet, and our transverse costal facet. Basically, we can see that in the ridges of this vertebra. And that is where the ribs are going to articulate with these. And so if we can remember, we have 12 ribs and we have 12 thoracic vertebrae. All right, let's go ahead and run through the lumbar vertebra. Similar rules apply. We're going to have similar features, but in different places. We're going to have our body, our vertebral foramen, our spinous process, lamina, transverse process, superior articular facets, superior articular process, inferior articular process, inferior articular facets. Now, that's all of the lumbar. It doesn't have many unique features, so that's all you need to know for this. Lastly, let's focus on how to tell the vertebrae apart. I already mentioned that the cervical vertebrae have their unique transverse foramen. But what about the thoracic and lumbar? For these, we can focus on the superior articular facets. They look quite different. Additionally, some people think this looks like a giraffe head, and some people think this looks like a moose head. But let's focus up top. These superior articular facets right here are facing upward, whereas these are curved a bit more inward. We can think of that as the thoracic vertebra wanting to give us a high five, whereas the lumbar vertebra are wanting to give us a handshake. That's another important way we can identify between thoracic and lumbar. This bone right here is called the hyoid bone. There are no features you need to know about the bone, you just need to be able to recognize it. All right, let's go and take a look at this bone right here. This is going to be our mandible, and there are two features we need to know. First, this is going to be our mental foramen, and there are two of them, so make sure you're including if this is the left or the right. We can tell that by kind of imagining this is our own jaw. And we can tell based on the teeth being in the front, this is going to be the anterior side, posterior side, and then we kind of align it to ourselves and tell this is the left and this is the right. So you can translate that to this being the right mental foramen and the left mental foramen. We're also going to have this feature up here, which is going to be the mandibular condyle. All right, next, let's talk about the bones that make up the structure of the skull. To start us off, we're going to have our frontal bone. Next, we're going to have our temporal bone and our parietal bone. Moving back here, we're going to have our occipital bone. Flipping us back around to the front, we are going to have our lacrimal bone, nasal bone. We're also going to have our zygomatic bone, our maxilla, and then if we flip it like this, we can see our palatine bone, and then our vomer. And if we were to open up our skull, we can see a great view of the ethmoid bone and the sphenoid bone. Now, one thing I will say is that there is no left and right to the skull, but there are left and right to these individual bones, so make sure you specify when you write them down. Additionally, a lot of these bones can be seen from multiple angles. We can see the maxilla here, but we can also see the maxilla here. We can see the sphenoid here, but we can also see the sphenoid here. Same thing with the temporal bones. We can see them here and here. And if you're to be asked on here, there's the frontal bone here, and frontal bone here. So as you go through, just make sure that you're aware of all the different angles these bones can be seen from to make sure you have a good understanding of location. All right, now that we've talked about its individual bones, let's go ahead and get into the features of the skull. First, let's talk about the sutures. Up here, we're going to have our coronal suture. We're also going to have our sagittal suture. Back here, we have our lambdoid suture. And here, we have our squamous suture. Also, we're going to have our external auditory meatus. Right here, we're going to have our foramen magnum. And then moving on, we are going to have our occipital condyles. We're also going to have the temporal process of the zygomatic bone, and then the zygomatic process of the temporal bone. So let's go ahead and talk about those because they can be a bit confusing. So the temporal process of the zygomatic bone is going to be this right here, whereas the zygomatic process of the temporal bone is going to be this right here. Basically, whatever bone you're on, if it's asking for a feature, it's going to be the process of the opposite bone. So zygomatic process of the temporal bone and temporal process of the zygomatic bone. Additionally, this is a structure known as the zygomatic arch. We're also going to have our mastoid process right here of the temporal bone, and we're also going to have our styloid process of the temporal bone. Moving in here, we're going to have our sella turcica of the sphenoid bone and our crista galli of the ethmoid bone. And those are all the features you need to know for the skull. All right, that is going to be it for this video. Thank you all so much for watching. If you have any questions, please feel free to reach out, and don't forget to always use your resources.